This is a new patient diagnosis teaching for a patient that came to the hospital presenting with an increased heart rate, shortness of breath, tiredness, low red blood cell, pale mucous membrane, leg ulcers, and gallstones. So we diagnosed her with sickle cell anemia and sickle cell crisis. So we're going to teach this patient a brief summary about her diagnosis. So, right, patient. So, sickle cell anemia, which it basically means that you have an abnormal hemoglobin on the red blood cells. You have hemoglobin S instead of hemoglobin A. What does that mean? So, this is what normal red blood cells look like. They are round, they're concave, and they're very flexible and can get through these vessels very easily. Now, with sickle cell red blood cells, this is how they look like. They change in shape and they look like this. They're very stiff and sticky. They like to stick to these vessels, and eventually they will block blood flow to these vessels here. Okay, so that's what is going on right now. So what's the cause of this? It's basically inherited from both of your parents. They carry the traits and not the actual disease. They carry the hemoglobin S trait, and they both pass down those the traits to you, and that's why you have the sickle cell anemia. Now, your red blood cells are very weak, and the diagnosis, the tests that we did to conclude this, your diagnosis, is that we first did a diatoneal test. I think I'm saying that right. Diatoneal test, and it tests for hemoglobin S. It does not test for the difference between the trait and the actual disease. So we had to do a hemoglobin electrophoresis test, and this it helps to differentiate between the actual trait and the disease. So at first we had to assess your skin, we had to check your respiratory status, O2 saturation, because when your oxygen is low, it causes you to go into that sickle cell crisis, and also signs of infection. So what we will do for you, some interventions to help you, is that we want to get more oxygen into your system. So we will give you some oxygen. We want you to stay hydrated, so we'll give you an IV fluid. We will be managing your pain, so we'll give you some pain medication, and also we can do a warm compression for pain. And we want you to be in bed. Bed rest is very important. We don't want you to over exercise your body. We don't want you to be in stress, because that can cause the crisis as well. And another medication that we want you to remember is a hydroxyurea, and that medication that we'll be giving you is to prevent the formation of the sickle cell shape red blood cell, and that's what we spoke about earlier. This shape here, this is what we want to prevent. So that's why we'll be giving you the hydroxyurea, to prevent that shape. We'll also be putting you on an IV antibiotic prophylaxis, and we'll be giving you that not because you have an infection, but because we want to prevent any infections from happening. And some patients do get a stem cell transplant, which basically means that you will be replacing all those bad red blood cells, the sickle cell shaped red blood cells, and bring in a healthy new red blood cells into your body. So A few things that we want you to keep in mind is that you want to avoid high altitude, and as we mentioned, we want you to avoid any stressing your body or over exercise, and stay hydrated, and avoid getting any infections. You want to wash your hand frequently and stay away from people that are sick.